And again? I don't believe her. She just kept it going, didn't she?
You can crop a video, it's alright.
Yeah, can you? Right, so this is called buckle. This is if Beth's having a seizure. Seizures have to be obvious and definitely not normal behaviour, because Beth obviously has, as you know, various kind of stiff bits and movements that are relatively abnormal, but they're not. Seizures fairly obvious, and seizure probably is affecting breathing. So it's much more obvious than that. So you're not looking for it, you're not kind of seeking it out. It's got to be an obvious event. If there's an obvious event that's happening and there's more than one of you, it's probably a good idea to start timing it straight away and possibly start videoing it as well, because sometimes people can tell what kind of seizure it is from the kind of seizure and the movements. But this is the epistasis pen thing. But essentially this is like an EpiPen, but it's called buckle, or it's actually called midazolam. And what you would do is, if Beth's having a seizure, and it would normally probably rectify itself within a couple of minutes, that's fine. You don't need to do anything. She'll be tired. You just track it and keep an eye on it and record it somewhere. But if it carries on for longer than 5 minutes, you would give, this is why you need time, as soon as you see it happening, you would give this first dose. And apparently in there, I've never seen it, apparently in there there's a syringe that's pre-loaded, I just read it, it's pre-loaded, and you would take the red cap off and put it between gum and teeth, and I don't think it particularly matters if it's 1 mil either side, just whack it in there, rub it in probably. That
is it like
should...
an injection or like,
No,
like
it's
a liquid?
it's not an injection.
No, it drips.
Oh yeah, it's just like solution that you put between
That will
them.
then absorb through the skin.
I assume so, yeah, that's the idea. And I think the gums are particularly good at absorbing it, I'm guessing there. And then essentially you wait and observe for 15. Hopefully by then it's stopped. If it hasn't stopped, you give the second dose. And then you would call for help. But you can call for help at any time throughout that, essentially. But you'd call for help at that point.